Second condition is sciatica. With regard to sciatica, my go-to is the L5S1 ELDOA. With regard to my physiotherapy clinic, whenever somebody presents with sciatica, I give them the L5S1 ELDOA, and 99% of the time, immediate improvement in symptoms. I want to talk a little bit about the 21 videos that I ended up editing yesterday. They were all related to nerve pain. It went over 20 common neurological conditions. And with regard to the individual conditions, I'm going to break down each one right now while we are resting. And I'm going to go over some of the exercises that I prescribed. The first condition is going to be radiculopathy. For radiculopathy, I end up covering the C5, C6 ELDOA, the L4, L5 ELDOA, and the L5S1. Those are going to be some of the most common issues that you're going to experience when it comes to radiculopathy. Second condition is sciatica. With regard to sciatica, my go-to is the L5S1 ELDOA. With regard to my physiotherapy clinic, whenever somebody presents with sciatica, I give them the L5S1 ELDOA, and 99% of the time, immediate improvement in symptoms. So that's one of the exercises that I go through. I also teach you guys how to perform the supine sciatic nerve gliding exercise, as well as the seated slump test nerve gliding exercise. The third neurological condition is going to be Cauda-Equina syndrome. For Cauda-Equina syndrome, I end up taking you through the L4, L5 ELDOA, the L5S1 ELDOA, as well as the supine sciatic nerve gliding exercise and the seated slump test nerve gliding exercise. Then, I forgot, cervical myopathy. For cervical myopathy, I end up going through the C5, C6, and C6, C7 ELDOAs. And then another condition that I discuss in the video is going to be carpal tunnel syndrome. For carpal tunnel syndrome, this one over here, it is going to be related to the median nerve. So I take you through the median nerve gliding exercise, and there's a couple. One of them is going to be more of a general approach where I take the upper limb tension test number 1 and simplify it a little bit. And then the second variation is the complete upper limb tension test number 1. I take the tension test and I turn it into a nerve gliding exercise. But those are the first 5 of the tests of the 20 neurological conditions. I'm going to go over 5 in between each set. So that we just covered the first 5. I'm going to go ahead, take a couple more minutes just to rest, bang out set number 2, and then we're going to discuss the conditions 6 through 10. That was just a tiny taste of what can be found in my members only section. If you enjoyed it, become a member for only $5 a month to get access to hundreds of member only videos.